I'm going to move on to the oral clinical exam in the conscious guinea pig. A lot of owners are unaware of the fact that guinea pigs' teeth grow continuously throughout life and the fact that they have cheek teeth. But it's important to explain what you're doing each step of the way. The guinea pig is already burritoed. I have an otoscope with a medium set speculum. And I also have cotton buds sitting waiting. And the reason for that is that unlike with the rabbit, where you should see no food in the mouth or no fur in the mouth, because that can indicate that the rabbit is packing the food round their teeth due to pain, it is completely normal to look in a guinea pig's mouth and for it to be filled with food. Often that will obscure the teeth, so you cannot have a good look in the mouth. So I've got the cotton buds there to swab out the mouth. I also warn owners that you can miss up to 50% of dental disease cases looking in a conscious animal's mouth. But you can actually miss up to 10% of dental disease cases looking in an anaesthetised animal's mouth, because in up to 10% of dental disease cases, the issue is with what's in the bone. So I'm going to now ask my assistant, Karen, to come and hold the guinea pig. Okay. So guinea pigs are obligate nasal breathers, just like rabbits, but unlike rabbits, their nares aren't so flappy, for want of a better term, so it's much more difficult to accidentally suffocate them. They also have a much harder skull than people give them credit for, and it's important that you've got adequate control of the skull so to minimise the risk of any damage. They often don't like their mouths being swabbed out with cotton buds, and to be honest, I can't blame them. I would be upset if somebody tried to do that to me. So I do tend to chat away to the pig while I'm doing that, because owners don't really understand some of the noises that they're making, and especially if there's children in the consultation, they can get quite upset. So as a qualified vet, you tend to develop something called patter, which causes the owners to focus on what you're saying rather than what you're doing. So in this situation, this is what I will do. So go in only half the length at a time. Oh no, what's that bad vet doing? Oh, you tell mum and dad what that bad Auntie Madonna was doing. Oh, were you going to save that? Now, this guinea pig isn't making any noise at all, but that's because Tyrrell's a teaching guinea pig, and he knows that he's going to get a treat after this, so he's not particularly bothered with me doing it. But most guinea pigs will scream and shout and generally make it sound as if we're murdering them. With guinea pigs, their teeth, when they overgrown, the lower teeth don't grow into the tongue, they grow over the tongue, resulting in bridging. So that's quite easy to see. And you're checking for symmetry, any lesions, any blood, scoriation, and any spikes. Thanks, Karen.